Good afternoon and happy Friday Eve. Welcome to today's Behavioral Health Stakeholder webinar with Arkansas Department of Human Services. This webinar is brought to you by ASMC. Today we will discuss the transition from RSPMI to OBH and review FAQs and updates. Before we get started, I would like to go over a few logistics. To eliminate background noise, the phone lines for today will be muted. Questions may be submitted through the online Q&A section located to the right of your screen, and we will answer questions at the end of the session. I just want to stress that it's the Q&A box and not the chat box. Today's event will be recorded and posted to the ASMC website. Once posted, all attendees will receive an email including a link to today's recording and presentation. Our speakers today are Patricia Gann with the Division of Aging and Behavioral Services and Kerri Brazzel with Beacon. I'll now turn the presentation over to Trish. Trish?
Thank you. Thank you for spending time with us this afternoon. We are getting very close to the final transition from RSPMI to OBH. We have 10 days left for those of you who are counting. We also want to just kind of give you some updated information. As of yesterday, we had completed 30,032 independent assessments for tier determinations for beneficiaries. So I know many of you want that information, so I just wanted to give it to you today right off the bat. Also today, if you have any questions about the enrollment of your providing providers or your rendering providers, then we also have Stacy Pickle and Yvonne Carbage here today who can answer some of your questions about that. So what we'd really like to do is kind of stay on topic. So we're going to do part of this and then let you guys ask questions, and then we'll do another part and we'll have questions, and then at the end we'll kind of open it up to all questions, but just to kind of keep things, so if you don't mind just holding your questions to what we're discussing at the time, please, and that way it'll help us make sure we answer all your questions because sometimes they get lost in there. So anyway, today just wanted to go ahead and talk a little bit more about this transition. One of the things that I really wanted to clarify, and I apologize for the confusion, I feel like that there has been some confusion out there in terms of the letter. We sent the letter out so that you guys would have a copy of that letter so that you could assist your beneficiaries in contacting DHS to request an extension. So I just want to go through this letter first and answer any questions about that and make sure you understand about that letter and who it was sent to. There was a group of approximately 3,000 beneficiaries who received the letter from DHS that instructed them to contact our office, and that is a DHS phone number, and request an extension within 15 days from the mailing date on that letter. This number that is on there is only to be used by those beneficiaries who actually received that letter from DHS and wish to request an extension of services through July 31st in order to allow them time to go ahead and schedule or get that independent assessment completed. That number was not intended for any beneficiary to call. So we're just asking that you please don't give that phone number out to beneficiaries who have not received a letter. If you have any questions about whether your beneficiary received the letter or not, you can certainly call us and we have the list, but they should tell you that they received a letter from the Department of Human Services instructing them to call. We provided you with a copy of that letter just as a way to help support your beneficiaries and assist them in calling. So if you have any questions about that, please let us know. But that letter did not go out to all beneficiaries. It only went out to a select group of beneficiaries who were receiving MHPP services, who have not had an independent assessment, and who had actually received via claims data a service, a mental health care professional service, within the last 60 days. So just wanted to kind of make sure that we clarified that letter and clarified what we needed you to do with that. We've been getting a lot of calls from people saying that I need to call and schedule an assessment. We've been getting a lot of calls from people calling saying my provider told me that if I don't call that I'm not going to get services anymore. So just please ask them if they received a letter and only utilize that telephone number for those beneficiaries. we really are asking that you leave that line open, because our concern is that we do have 3,000 beneficiaries that need to call into that line, and if other people are calling in, then we're concerned that those beneficiaries are not going to get through. And we have a question up there, and so I'm just going to go ahead while I'm in the middle of this and answer this question. It says, if Medicaid secondary to Medicare, is a PCP referral required for Tier 1? And the answer to that question is no. That my understanding is that it's going to bypass the PCP edit, and so therefore if they are dual eligible, Medicare and full Medicaid, or Medicare and or private insurance with Medicaid secondary, then it's going to bypass that PCP edit. Also, are there any questions about the letter? I don't see any up there right now, so okay. So we're going to kind of move on. Independent assessment referrals, and trying just to remind everybody that as we go through these sections, please, we're going to try to answer questions about each section, and we'll answer general questions at the end. So also about independent assessment referrals. So going forward, you guys have the opportunity to refer a client for an independent assessment through Beacon. Referrals may only be requested by a behavioral health provider, and that's a provider agency or a provider, an independently licensed practitioner, or the state will sometimes initiate requests under certain circumstances, but that's a real rare kind of situation. The referrals, for the most part, are all going to go through Beacon. So if beneficiaries call Optum and say, I need to schedule an independent assessment, or I need a referral for that, Optum cannot create those. There's really not any way where we can directly create a referral. So DHS, Optum, beneficiaries cannot call Beacon or call Optum or call the Department of Human Services and directly request a referral for an independent assessment. That's going to need to come through our provider organizations, either our independently licensed practitioners, or it's going to have to come through our outpatient behavioral health agencies. Also, just wanted to provide you guys with a telephone number. So a beneficiary can schedule an assessment if there's an open referral in Optum by contacting Optum at their number 1-844-809-9538. If you have a beneficiary who is currently still on that list, and that list is done, and we're doing those embed closeouts, and we've got the 3,000 beneficiaries that we know have received a service, and we're going to go ahead and give those an extension if they don't get those assessments completed before June 30th. We're going to give them until July 31st to get that done, and we're going to give you guys a confirmation number, and we're working on the process by which we're going to do that. That confirmation number for that 31 days will come from Beacon, and they are in the process of actually sending out their first confirmation file. And so Kerri's going to talk about that. But if you have a beneficiary that's on your list right now and you know there's an open referral out there for them, then you can certainly assist them in contacting us at that number to schedule their independent assessment to make sure that that gets done. If you've requested an independent assessment through Beacon for a beneficiary who wasn't on your list or who is new to your organization, then you can assist that beneficiary by sitting down with them and contacting Optum to schedule that assessment. If you will, please give us 72 hours. So it's like you submit that request for an independent assessment today. If you're asking for a referral for an independent assessment, you submit that through Beacon. Beacon is then going to create that referral and send it over to Optum. Please give us at least 72 hours. It'll probably be there earlier than that, but please give us at least 72 hours to make sure that referral is there before you call. We certainly don't want to waste your time or the beneficiary's time calling and you're crossing between when that referral is created and it's being sent over. So for our purposes, to ensure that that referral is worked and then sent over, just please give us 72 hours, and then you can call with your beneficiary and assist them in scheduling that independent assessment at a place that's convenient for them. And so Kerri is going to talk about how providers are going to make those referrals for independent assessments in a minute, so we'll answer that question. Just want to remind everybody that Optum does not have the ability to create referrals for providers or clients. They can only process referrals that have been created by Beacon or by the state. And when we say we create them, what I do is I call Beacon. So not even I can go in and create a referral. So when we say the state in certain circumstances, what we're meaning is that the state calls Beacon and Beacon creates those referrals. So that's how that referral process works. Also, just want to talk a little bit about extensions of benefits. I think there's been lots of questions about extensions of benefits, and I just wanted to do some clarification on this. The regulation states that extension of benefits are required for all services when the maximum benefit for the service is exhausted, and that the yearly service benefits are based on the state fiscal year. So the fiscal year starts on July 1st. So y'all all know that we are giving you a confirmation number that is going to be for half the benefits package because we are only running this program for half a year. The PASs are going to pick this up when they take full risk on January 1st. So what we've kind of asked you to do is to utilize those services and then request an extension of benefits. You know, we've talked about how in some rare cases, like if you're providing services to a Tier 1 beneficiary, because Tier 1s are not going to roll over on January 1st. Tier 1s are going to go for the entire benefit period. So you can go ahead once you exhaust those and utilize those, or if you're providing an evidence-based practice and you know, for instance, that trauma-focused CBT, that evidence-based protocol says that you're going to do 15 sessions, we've kind of told you that you could go ahead and ask for those other 3 sessions. What we've had is an influx of people who are asking for massive units of services and massive encounters for services. And so just want to make sure you all understand that Beacon is not going to process those until we can look at medical necessity based on the impact of the treatment that you've already provided. So for the purposes of extension of benefits, you need to go ahead July 1st and start providing those services. And then as you get toward the end or you get close to exhausting those benefits, you then need to send an extension of benefits so that Beacon has the opportunity to review those records and determine the medical necessity for that. So just want to really make sure to understand if you've submitted a whole bunch of extensions of benefits for massive numbers of encounters, Beacon's not going to process those right now because you haven't obviously provided those services, and because you're going to get that confirmation number on July 1st. So even if you've already switched and you're going to get that confirmation number, we need to utilize those units until they're getting close to being exhausted. We don't want you guys to have to assume risk. So if you have some concerns about whether those will be approved or not, you can go ahead when you're getting close to using them and ask for that extension of benefit. So again, a lot of the questions are about how do we request an independent assessment. So Kerri's going to come and answer those questions, and she's also going to talk about confirmation numbers. So she's going to come and deal with both of these issues right now, and we'll answer your questions.
Okay, thank you. Sorry, I was in transit.
There is a question up there that I'm going to go ahead and answer, and that's if a patient is given a Tier 2 level of service, but the mental health professional doesn't see medical necessity for that level of intervention, will they be held to the level 2 requirements? Yes. If your beneficiary has been assessed to be a Tier 2 or Tier 3, then you will be held to the level of that tier. Those beneficiaries will be attributed to a PASS. They will receive care coordination, and you will have to complete a treatment plan. You will have to follow the psych eval. We are working on a process for beneficiaries to opt out, but that process we do not have right now. So if a beneficiary was assessed and they received a Tier 2 or Tier 3, that beneficiary is in Tier 2 or Tier 3, and you must meet all of the requirements for Tier 2 or Tier 3, including treatment plans and psych evals and all of that. You will not have to submit a PCP referral with those claims.
Okay, thanks, Trish. This is Kerri with Beacon, and Part of what I'm going to go over today is just a recap, or reminder, I should say, of what I went through last week about new providers who've transitioned, making referrals on new beneficiaries. However, since confirmation numbers is up, and I know that's a big question, I'll go over that update real quick first. We do have, like Trish mentioned, we do have our first kind of round of lists ready to go out, and what I mean by that is, you know, as a reminder, when we first started kind of talking about this process of us generating these confirmation numbers for everyone, we were prioritizing the provider sites, particularly that flipped prior to July 1. So these are the lists that we have ready to go out. This is not going to be the only list that you will receive. How they were pulled was based on, we pulled from a list of beneficiaries who had been assessed up until through a certain date. I believe that first list was pulled based on all beneficiaries who had a tier determination, not just assessed, but also had their tier determinations back by June 1st. And then we pulled those by those provider sites that had also flipped. We're going to flip prior to July 1st. So that was our first batch, as we're calling it. We do have those ready to be sent out. There are some final confirmations through testing with DXC to get those to the production side, if I'm getting that terminology correct, to ensure that, you know, but everything is going well as far as my last update in terms of receiving it by DXC and testing it in terms of processing those on their side. I do have those ready to start sending out to the providers who have transitioned. But I just want to reassure you guys that when you get these lists and you open it and it's not your entire caseload, that's because we're still working on updating and capturing those that have been assessed or we've received tier determinations since that first big pull. Our second big list is going to be even larger because we're going to capture everyone who was not pulled the first time for the early flippers. So all the flippers happen in July 1. In addition to assessment determinations that have been returned since that first list, there's going to be, you're going to get at least probably 3 of these, I would say, between, you know, maybe tomorrow. Hopefully we can start getting those out this afternoon, tomorrow, through the first week of July. There's going to be up to 3 different lists or, you know, rounds that these will be sent out. So don't panic when you get this first list and it doesn't encompass your entire caseload. There are more coming as we process them. The first one took some time because it was the process of actually building the package and building the file. My understanding is now moving forward, applying these to these additional lists is not going to take quite as long. It's going to be a quicker turnaround time now that the file is built. My understanding of the technological process. So that's an update on that. They are going to start going out, and it's going to kind of be a running basis over the next couple of weeks, I guess. That is our plan with those. And so they are on their way. They are being processed. We're getting updated lists so we can get those processed. So that's kind of where things are with confirmation numbers. I guess there's anything I didn't hit on that. Oh, I do know, sorry. Our plan on who was going to receive those lists is probably another question y'all have. What we're planning on doing, it is an Excel spreadsheet you're going to receive with recipient ID, Medicaid ID, and the PA number attached to that. And for the early flippers, the start date of those is going to be July 1, because before that we received confirmation numbers through our system already. They'd already been processed. And then, so the start dates will be, will be correct. And we're going to send those to our designated distribution list for those who receive other reports from us. Inspection of care reports, we have designated distribution lists and contacts for all of our big reporting purposes. And so those that are on those lists that regularly receive inspections of care reports and things like that, that's who we will send these lists to.
So we have a couple of questions that we want to go ahead and answer. One of them is a carryover from our extension letter, and it says what services will be extended. And the services that will be extended are the OBH services, so we'll prorate those and extend the OBH services to them. The other is, will Tier 1 need a confirmation number? And the answer to that question is no. Tier 1 beneficiaries will not need a confirmation number. Kerri, do you see any up there that you?
And there's the questions about if you're flipping July 1st, does the confirmation numbers come after or before? It's probably going to be a little of both, probably. This next big pool are going to be, there's going to have some on that, because we're just going to pull everybody at this point. And so a little bit of both. You'll probably still get at least two lists, one hopefully on or around July 1st, and then there's going to be a follow-up to kind of capture those that are, continuing to get assessed after the embed ended on the 15th. We have to have a process to capture all of those as well, whereas the determinations come back through the, the 15th through the 1st of July. So a little bit of both. You might get a list for some that had their determinations that were returned and completed prior to July 1st. And then any that were coming in during that, that last time frame, the end of the embeds through July, as we're capturing some of those, we're going to make sure and pull those and do another list. So hopefully by the first, second week of July, we'll have all those ready to get out. That's our plan, anyways. But
yeah,
makes sense.
There's also, to clarify, Tier 1 authorizations will go to the full fiscal year. There are no Tier 1 authorizations except for those services that require prior authorization, which are your dyadic services. So for your Tier 1 beneficiaries, on July 1st, you will get the benefits package. And when you exhaust the benefits package, you will ask for prior authorization, an extension of benefit for services after that. So for Tier 1 services, you don't have to do anything. On July 1st, those services are available. They're in the benefits package, those counseling level services. The system is going to go out and it's going to look at the tier determinations. The tier determinations are out there. It's going to go out and look at those tier determinations, and it's going to say this is a counseling level beneficiary. They don't require prior authorization. They don't require anything. And the services are then going to be available for you for the whole year. And so at any point in time when you've utilized those, you can request an extension of benefits. Can you confirm the daily max? You go back up time. On behavioral assistance. So for behavioral assistance, and let me make sure I look up youth and family support services. I'm still trying to memorize the manual. So child and youth support services, there is, as you've noticed in the manual, there is no daily max on either of those services. However, the 8-hour-a-day max does apply. If you've had some claims issues with those services, then you will need to contact us so that we can assist with that. Yeah. So, you can go up to your total number that you have in that benefit to that period. So if you've had claims issues, then please contact who do we contact?
You can contact provider assistance.
You can contact provider assistance.
I believe that's been an issue that's identified.
Okay.
And they're working on changes.
And thank you to those who are already out there submitting claims for being our guinea pig so that we can get this all fixed before July 1st. So I know it's probably not good for you, but I want to say thank you. If a client gets a Tier 3, are we held to that tier as well, even if the therapist doesn't see medical necessity? That doesn't mean, so if you're at a Tier 3, it doesn't mean that that client has to go into a therapeutic community. If Tier 2 and Tier 3 build upon each other, well, actually all of the tiers build upon each other. So Tier 1 services are for those clients in counseling level. Then if they have a Tier 2, they get all of Tier 1 plus all of Tier 2. And then if they're a Tier 3, they get all of Tier 1, all of Tier 2, and they have available to them all of Tier 3. But just because they're a Tier 3 does not mean they have to go into a residential or to therapeutic community. They can receive Tier 2 services. But the treatment plans, the psych evals, and all of that are required at Tier 2 and Tier 3. So those are required. Do you have to have specialized training to do an intake for someone that's under 5? Yes, you do. You add not under 5, under 4, so 0 to 47 months, yes. You have to have special training and you have to receive, you have to be enrolled as someone who can provide those services. You're not going to, we're not going to go to the middle of July on confirmation numbers. The plan is to have all confirmation numbers out by June 30th. So there may be some as we go forward, but the plan is to have them all out by July 1st. Okay, so we're going to go ahead because now we're getting questions about the manual. So we're going to go ahead with Kerri and let her do the independent assessment part of it.
Okay. And again, this is what we went over last week, so hopefully just to clarify any questions, kind of go back over it, make sure everybody understands what the process and how we're utilizing this as of right now. So again, this is, oh, slides are not moving. Okay. So again, this is, sorry, we had technical difficulty. So this process, again, is for agencies that have transitioned to OBH. So again, I'm kind of prioritizing here agencies, providers, I can see them, who have transitioned, who are providing OBH services, and get new clients come in, and you need to refer them. They've not been assessed. So again, we're continuing to use this, use Provider Connect for this process. You are going to submit, we say request, really you're submitting for a referral, just language-wise, those of y'all that use, and again, this is going to make a lot more sense to staff, to utilization review staff, your staff that regularly enter requests in Provider Connect. I can provide these slides to you so that you can share them with those staff if they're not able to participate in these webinars. Because when we talk about entering certain information in the system, again, it's going to make a lot more sense to the staff that utilize this system. And so, again, just my contact information is in here. I'm sure most of you guys know how to reach me. I can definitely provide these slides to you guys so that you can have them for your utilization review staff. So we are going to continue for new beneficiaries that have not been assessed, submit a request in Provider Connect. You are going to indicate that it's your rehabilitative or intensive level type of program. Again, we got the screenshots. We'll go back over to show those. Because this is just a referral, this is not, you're not requesting a confirmation number, you're not having to justify anything. Nothing needs to be attached to this. You don't have to attach a treatment plan or any documentation. As y'all know, there are required fields in the system. They're fairly minimal, but you do have to put something in those fields that have an asterisk, and that's just a technical piece where that won't let you, proceed through the screens if you don't do that. But they're fairly minimal. Just put something in there so you can move along and capture what you need. The important piece, remember I said last time, there's two key pieces to make sure these get picked up for a referral. The first piece is that you're indicating it's a rehabilitative or intensive level type of program. That is saying, indicating that you're referring for an OBH request for a referral for a Tier 2 or Tier 3 assessment. And additionally, this red, about this bottom bullet point with the red information, in order to capture good contact information for this referral so that we can send it over to Optum and they have a good way of contacting, or the best possible way of contacting these beneficiaries or their guardians to schedule, there is a box in Provider Connect that says beneficiary's guardian. In that box, please enter a name of that guardian. If it's an adult, you can put self in that box, or you can leave it blank, and it will default to, knowing it's the beneficiary's contact information. But if you indicate self, that will indicate that it's the phone number being entered is also for that beneficiary. Then in the narrative entry box, and I will show you these screenshots in just a second, in the narrative entry box I'm about to show you, please only enter the phone number. And you don't have to put any other information, and please do not put any other information in that box, as it will not pick up that phone number if there's other information in there. I think it's too much to capture in that field. What is happening is we did get a few requests where they entered the phone number, but then they also thought they had to kind of indicate a justification for why they were requesting a referral. That is not necessary. We do not need to know why you're requesting this. We are assuming that this means they do not have a tier, and that's why you're requesting a referral. That's kind of the understanding in utilizing this process. and they don't have a tier determination in our system, that is justification right there that they need this referral. You do not have to put in. I know y'all are used to using that box to enter justification or information about what you're submitting. That is not necessary for this referral process. We only need the phone number in that box, and that way it will be captured. And I'm going to show you what this looks like, so it'll make a whole lot more sense hopefully here in just a second. Okay. So when we say pick rehabilitative or intensive type of program, and again, this makes a lot more sense and looks familiar to those that use the system, and they will understand what this means when we provide them these slides. But they're going to pick either intensive or rehabilitative on this first screen they come to. And you can see some of these boxes that have asterisks. That's what I mean by those will have to be filled in. But again, they're used to pulling those, and it's going to help indicate mental health and outpatient, and it's going to help indicate what type of program just to generate these referrals. Here is where it's asked you can enter the beneficiary guardian information, or you can just put self if it's for the beneficiary themselves. The contact information above, contact name and phone number, typically is where you guys as a provider, your utilization review staff, that's where y'all's contact information goes so that we know who to reach out to if we have questions, if we need to verify some information. In this beneficiary's guardian box, that is where you're going to put the guardian's name that they'll be contacting, or again, you can just put self if it's for the beneficiary as an adult. That's where we're capturing that. And it's important to note that because there's not an asterisk in there. So you will be able to move forward. But in order to get a good referral and be able to contact these beneficiaries, we have to have this information. Here's the narrative entry box where we're capturing the phone number. And again, people are used to using this box. They're used to putting information in this box. For this referral purpose, we only need the phone number to be entered in this box. We don't have to put any other information, no dates, no justification. Just enter the phone number here, please, and only the phone number. What I haven't mentioned in terms of entering this, initially we asked that you guys only, the system is going to ask you to pick a service. So when you get to the end of all these screens, you will have to enter a service, pick a service related to rehabilitative, Tier 2 or Tier 3. We did say you can pick any service. So what's happened is a lot of people are picking the very top service, which makes sense. They're picking the top one on the list. However, those for some reason end up being substance abuse services. And we have to go back and build the author. When we get the tier determination back, as we're going to talk about, if it's a Tier 2 or 3, we're going to go ahead and build that authorization and send you the confirmation number. So it really would be best if you can kind of be mindful of picking a service that's actually in the package of Tier 2 services, individual therapy, group therapy. Those would be safe ones. But you do have to pick at least one service. And then, again, when we get to those determinations back, for Tier 2 or Tier 3, we will then just build that confirmation and send you that number just like a regular PA request. But again, we can't do that until we get that tier determination back. If it comes back as a 1, or if it comes back as a 1, it will be closed. Or if that referral, we don't receive a tier determination back within a certain time frame, it will be closed and you'll be notified that it will be closed due to ineligibility. And that will be kind of your confirmation that they did not receive a Tier 2 or 3 determination. So we will be to build a confirmation as appropriate for a Tier 2 or 3. Okay. And again, here are our contact information. Shirley, I forgot to apologize last week. Suzy's in here, and I didn't put Tasha's title in there. I have other ones in there and left out Tasha's, so I apologize to her for that. But here's our contact information. Again, if you guys want a copy of these slides that you can share with your staff that enter these and make sure that they have the process down, please just let me know, and I can shoot these to y'all so that you can share them with your staff so they have the process for entering these and making sure they're capturing that information where we're asking it to be entered.
And just a reminder, once the recording is posted to the website, every attendee will receive an email with a link to access the recording and the presentation.
Okay.
And just a reminder also, if you have questions, you can submit them through the Q&A box at the right, to the right of your screen.
Yeah. So we're going to start going through some of these questions now. So can we request an IA through Beacon Provider Connect if we haven't made the flip to OBH yet, or do we have to wait till July 1st? You can go ahead and submit those. I mean, Optum has a time frame to work those, and so if you want to go ahead and start submitting those, Kerri, then are y'all okay with that?
So this is still on new beneficiaries, yes. Correct? As long as they, yes, if it's a new beneficiary and they have not been assessed, then yes. I'm just trying to think, if you're still RSPMI, it's been picked up on the RSPMI side, but if they're new, that's the only thing that's...
Yeah, if they're brand new, if they're new to you and they're coming in and you want to request a referral, then yes, you can go ahead and start doing that now.
Mm-hmm. When are you going to flip?
Yeah, so...
Because also, like I didn't mention, I mentioned last week, is that we have had a process in place for those continuing under RSPMI, if those are being picked up as well. And so, yes, on either side, they should be picked up.
And we've already talked about confirmation numbers. If the patient is given a Tier 2 level for service, we've already answered that one. Let's see what we haven't answered yet. Is it child and youth support services? Does the child have to be present, or is this a service for the guardian? Can it be billed with staff and teachers? Let me go to make sure. So child and youth support services are services that increase a child's positive behavior. So these are services where you are working with the parent, or you are working with the school or educational staff. So this service is not a service that is provided with the child. It is a service that is provided with someone who is a caregiver or who is in contact with that child. So yes, guardian, and yes, it can be billed with staff and teachers. Is it possible to obtain a concise chart that summarizes the annual limits that we're going to receive for each tier and the service type? Actually, there is a concise chart out on the Beacon website. You can look in the manual, but Beacon actually has created that for you, and it is out on the website. So you're more than welcome to go out onto.
We do, yes, we do, because we, just like we have the, y'all again may not be familiar with this, but we have, for RSPMI, we have forms where if you have to submit a request via form, we have what's called outpatient review forms or forms, and we did create those for these new services as well, and that's got the limits on it. So again, if you reach out, I can send you a link to our website if you're not familiar, but under for providers, we have clinical forms, I believe it's called, and then on that we have all those posted on our website. But yeah, email me, this is Kerri, the top email address, and I can shoot you a link to where those are.
Like, is there a time limit for submitting treatment plans showing OBH services? You're not submitting those treatment plans. You just complete those treatment plans prior to the visit, prior to the provision of OBH services. So there's no need for anybody to submit a treatment plan. The only time you would submit a treatment plan is if you are requesting an extension of benefits. And in that particular case, you would go through that extension of benefits process, and you would submit the treatment plan and all the documentation to show medical necessity. So for those who will transition on July 1, do we have to wait until then to request an IA referral? So there's a difference. If you've got, if you are transitioning on July 1, then you don't have any new beneficiaries. You could, if you have a new beneficiary that comes in between now and July 1, you certainly could submit a request for a referral before then. If these are beneficiaries that you already have in your agency, those beneficiaries, we have already looked at those. They've either already been submitted through Beacon, through the prior authorization process. They've been picked up some way for an independent assessment. So those are existing clients, and we're working through those. So please do not submit referrals for existing clients that you've had because they've already been picked up through some process. And just one more thing about submitting a request for a referral. Every single day, all of us are taking phone calls from beneficiaries' guardians and from beneficiaries who are asking us if they can opt out or asking us why they are getting an independent assessment. I talked to a mom yesterday that said, all my son gets is an occasional individual therapy appointment and med management for ADHD. Why do I have to complete this assessment? She does not have to complete this assessment. Like I said, we are getting phone calls every single day from beneficiaries and from guardians that are asking us why and telling us what services these clients are getting. These services, Tier 2 and Tier 3 services, are intended for those beneficiaries who need those types of services. Please don't submit referrals for people who aren't receiving them or who don't need them, because that is creating quite an issue with us receiving phone calls from beneficiaries and from beneficiaries' guardians, because understand, if they are assessed and they are Tier 2 or Tier 3, they're going to get a call from a care coordinator. That care coordinator has to meet with them at a particular interval. That is not, that's not optional. And so you might want to discuss with your beneficiaries before you submit them for a request for an independent assessment. You might want to have a discussion with them around care coordination, around all the services that are going to be provided and what's going to happen with the PAS, because care coordination, attribution to a PAS are not optional. If that client is assessed at Tier 2 or Tier 3, they need a confirmation number. I understand the process, but through the end of June is the only way to request an IA for a new client to submit a PA request. No, you can go ahead and submit. If you don't want to submit a PA request, if you want to just provide benefits packages services until you get to do one, or just 10 days away, and you don't want to do all that paperwork, then go ahead and just request an independent assessment. Yes, we're going to put the questions. So the question is it possible for questions from these weekly webinars to be compiled and put into an FAQ on the website? Yes, they will be posted on the website. We're still just trying to compile all those questions and make sure that we get everything, and then we'll put it out there. If you have questions about the spreadsheet, contact Beacon. There's a question about knowing what columns are going to be in that. So if you have questions about that, just contact Beacon, and they can tell you the columns on those spreadsheets. So for multifamily therapy, does the client have to be present? Documentation requirements state that there's a rationale for excluding the beneficiary. No, they do not have to be present, but you do have to have a rationale if you're going to exclude them from that. So on substance abuse, can you open a new case intake who is seeking substance abuse services with a substance abuse assessment, or does a mental health diagnosis have to come first? No. This is one of the awesome things about this new program, is if that client is just coming in and they're saying, I want treatment and I want individual therapy, multifamily group for substance abuse, you just complete the substance abuse assessment. You do not have to complete the mental health assessment. You do need to screen in some way during your assessment for mental health issues. So here's the caveat to that. If you determine that that client probably has a mental health diagnosis, then you do need to complete that mental health diagnosis. And at that point, the mental health diagnosis or the behavioral health diagnosis becomes primary on all of your billing, and it becomes your primary diagnosis. So just remember, and at that point, you treat the substance abuse disorder as it relates to your primary behavioral health disorder. So there's some language. It's in the very back of the book. It's on page 91. You need to go to page 91 and read the language. No, I haven't memorized the manual yet. They're laughing at me. But go to page 91 and read the language around those who are dually diagnosed. Does the PCP have to be added onto the claim for Tier 1? In the past, it's been identified in an audit. Can an obstetrician be a PCP? I don't know the answer to the obstetrician. Does ASNC?
An obstetrician can be a Medicaid PCP. There's a packet on the Medicaid website under the Section 5 forms for a provider agreement that can be completed, and that is the specialty of provider type that is eligible to be a Medicaid PCP.
And I believe that you have to put the PCP's MPI, you have to put a number on your claim, and that has to match eligibility. So it's the same way that you are dealing with PCP referrals right now for your U21 beneficiaries. That PCP would need to be on the claim, and it would need to match what's in eligibility. Can a child be present? I don't think you would want a child to be present during child and youth support services, because you're going to be talking about how to deal with that child's behavior and developing behavior plans. So I would think that probably the child would not be there. For psycho, I'm trying to read these questions real quick. For psychoeducation, oh, sorry, I lost it.
Where'd it go?
It was a question about psychoeducation. Psychoeducation is provided with the beneficiary and their family. You can utilize natural supports, but this is not a service that may be provided to the beneficiary alone, neither individually nor in a group. The beneficiary and the family members are present during psychoeducation. There is a huge difference between behavioral assistance and life skills development. Life skills development is for that transition age youth population, and that is things like teaching that child how to live and like how to maintain a household, maybe how to do dishes, how to dress for an interview, job skills, those kinds of things that are just really life skills kinds of things. Behavioral assistance is an absolute treatment. It is going to the beneficiary's home or to the school and providing intervention. Go back to kind of your intervention, your mental health care professional intervention services. It is an active, hands-on treatment with that beneficiary during those times when that beneficiary is most likely to have acting out behaviors, or most likely, so that may be at bedtime when parents can't get them into bed. It might be in the morning when they can't get them to school. It may be at school during a particular class, but there is a huge difference between that. Life skills is just basically kind of like, here's how you open a can of soup and heat it up in the microwave, possibly. And behavioral assistance is a very hands-on intervention that is treatment-related with that beneficiary, that requires a particular level of training and education and management of that beneficiary's behaviors. I'm going to have to go look some of these up. If you're requesting partial hospital confirmation, we do need to send the treatment plan. Is that correct, Kerri?
Yeah, because that's one of those that's outside of it's a specialty, so it's requested outside of the package we're building for confirmation. I do believe we've actually gotten a couple of those.
Yeah. And that would just indicate that that's what you're asking for. And also they're gonna look to see whether Sherry Proffer over here has certified you as a partial hospitalization.
That's right. Yep.
So, by the way, Sherry Proffer came in and Victoria came in while we're in the midst of this. So I want y'all to know that they're here in case you have any questions.
This is Sherry. Don't forget the deadline is
is it next week, the 29th?
Yeah.
So after the 29th, if you haven't transitioned, you will not be able to bill.
There are many clients that have PA requests for RCMI services within the last 2 months have not hit the option assessment list. Those PA requests were specific. There were PA requests for mental health paraprofessional services. So having a PA request alone did not put them on that list. The other thing is that we went back and looked at that list, and so the beneficiaries that we went in and added in and made sure were on there were the beneficiaries who actually received a mental health paraprofessional service. So it was a prior authorization for an MHPP service, and in the end of that, we're looking at a provision of. There are approximately 100 beneficiaries that we're going in and looking at, but I think 100 out of about 45,000 is really probably not too bad. So we're looking at those to make sure that they did get. But if they didn't get picked up and they received a service, then they are picked up in the 3,000. Is it possible to provide Tier 1 services to a 3-year-old if they exhibit exceptional medical necessity? You can provide Tier 1 services to a 3-year-old, but you must have been endorsed by the Division of Behavioral Health Services and shown to have treatment in DC-03, and also to have the ability, you're either a PCIT certified, CPP certified, some type of certification that specifically is age appropriate for those beneficiaries. So a 3-year-old may receive Tier 1 services. Well, they may not, their parents, it's a dyadic treatment. So just remember that they and their families may receive services, but a 3-year-old can't receive services alone, all by themselves.
And they require prior authorization. Those are the only Tier 3 services that do require prior authorization as well.
And you don't have to be certified as a substance abuse provider. So if you are a behavioral health agency, I'm going to answer this for Sherry unless she wants to answer it. Thank you. If you are a behavioral health agency and you wish to provide substance abuse services, you must have a substance abuse license at the site in which you are providing those services. The substance abuse licenses are site-specific, not agency-specific. So if you want to provide substance abuse services to a beneficiary and you are a behavioral health agency, which is the current RSPMI agencies, or you're a new behavioral health agency, your site has to have a substance abuse license. If you are an independently licensed practitioner and substance abuse is within the scope of your practice, you may provide substance abuse services to Tier 1 beneficiaries or counseling level beneficiaries without being licensed as a substance abuse site. Thank you, Sherry. Substance abuse services are Tier 1 services only. Clients, in order to be referred for an independent assessment, have to have a mental health diagnosis. So if you have a beneficiary who has a dual diagnosis, then a treatment plan would be required if you are going to provide Tier 2 or Tier 3 services. But a treatment plan would not be required if you are going to only provide Tier 1 services or substance abuse services only. The question is, for substance abuse assessment, Medicaid definition specifically references the ASI, which is for adults. If we choose an assessment other than the ASI, does it have to be approved by Medicaid? It has to be approved by DHS or that substance. So you would contact the substance abuse section over at the Division of Behavioral Health Services to get those assessments approved. So do services, psychoeducation, interpretation, and diagnosis need to be on the treatment plan to be delivered? All services that you're going to deliver need to be on the treatment plan. Can a QBHP be one of the staff in determining the staff-to-client ratio in partial hospitalization? No. There are some really specific guidelines around partial hospitalization and staffing ratios. That staffing ratio includes independently licensed clinicians, non-independently licensed clinicians, RNs, physicians, and APNs. So a QBHP may not be counted in that ratio. Sherry, who do they need to submit the annual DBHS reports to?
Me.
Sherry Proffer.
And let me give you my address. I'd rather have you mail them than email them. If you need the form, I'll go ahead and email that to you. My email is sherri.proffer, PROFFER, @dhs.arkansas.gov, G-O-V. I'd like you to mail those annual reports because they are pretty thick. And then, let's see, you can address it to Sherri Proffer, BPSQA, Post Office Box 8059, Slot S, as in Sam, 408, Little Rock, Arkansas 72203.
Can you repeat what you said about multifamily group? So multifamily group is the interaction between two or up in a maximum of 9 beneficiaries and their family members or significant others. However, so in a multifamily group, going back over and looking at this, it is between the beneficiaries and their families. So you would have the family and the beneficiary in that particular multifamily group. It says may be treated independently if the patient is being treated for substance abuse diagnosis. And so I'm going to go back and really kind of get with our team and make sure that we know what that is. The skills test for your QBHPs, there's no difference in the skills test for your mental health care professionals. So if you were providing a skills test which was required under RSCMI, those requirements for certification didn't really change, then it's the same skills test that you are utilizing under with your QBHPs. We have a long list of Medicare, Medicaid services that have been paper billed multiple times. Will those be paid for after 7, whatever? Stacey, do you? 7? 1. Okay. It's like, I can't read that. Well, they have a long list of Medicare, Medicaid services that have been paper billed. Will those be paid after 7/1? I don't know. Okay. So yeah, you probably just need to contact claim provider assistance for that. And a child under 48 months receive a psych eval or a psychological evaluation when a differential diagnosis or medication concern needs to be addressed. No. There are a very distinct group of services that may be provided to children between 0 and 47 months. Please refer to the manual for those services. You will find that those services are indicated in the service definitions as well as the codes for billing those services. So those are the services that are currently under the OBH manual allowable for 0 to 47 months. If a client comes to your agency after receiving services from another agency, do you have to get an EOB in order to bill the MHE? Yes, you will. There's only one per fiscal year. So if you provide it after July 1st, then you're going to have to get an extension of benefits. So our dyadic services and Tier 1 services available for 3-year-olds with the appropriate medical necessity if provided by a provider who is certified. So they're not separate services. The dyadic services are contained in the counseling level or Tier 1. They are specific in the manual. So please go to the manual to look at the specific services which may be provided to 0 to 47-month-old children. But yes, you do have to enroll with DHS, the Division of Aging, Adult, and Behavioral Health Services now, and show them that you've completed the DC-03 training and also that you have certification in a particular evidence-based practice that for those types of children. Do you have to do a 90-day review on substance abuse clients? Sherry Proctor is researching that, and we're working on it, so we will get that answer back to you at some point. But for the purposes of OBH, substance abuse clients do not at Tier 1 need a treatment plan. Do Tier 2 or 3 clients, they don't need a PCP referral? That is correct. Do they still need a PCP assigned? Yes. As a matter of fact, one of the things that the care coordinators have been tasked with doing, one of the first things they've been tasked with doing, is working to make sure that all Tier 2 and Tier 3 clients have a PCP that is assigned. What do you do with the confirmation number when you get it? Put it on your claims in the same place you put your PA number. Does a child have to have a trauma-specific diagnosis? No. That's why you need the DC-03 training or the DC-05 training. They do not have to have a trauma diagnosis, but they do have to be diagnosed using DC-03. Kerri, if you want to answer any of these questions while I look looking up.
What about PIN?
Oh, there's a PIN number question. Good. I would like to know why we have been told about PIN numbers multiple times in these webinars, but we have not been told about the provider group affiliation forms that all providers within a group have to have or services will be recouped. So the RA message that went out, Yvonne, do you and Stacy want to go ahead and take that?
A RSPMI or OBH provider is not considered a group provider, so that notice concerning group providers is not applicable.
Did y'all hear that? Stacy's kind of sitting over there, but the notice in reference to group providers is not applicable to RSPMI providers. You are not group providers. I know.
We have a question that says, please clarify that peer support can be provided through a group service. So Trish is looking it up as we speak.
It says services may be provided on an individual or a group basis in either the beneficiary's home or a community environment.
So we've answered all of the questions that we currently have. We'll wait a couple of minutes. If you have any more questions, please submit them through the Q&A box to the right of your screen.
So the question is, this week, the Provider Enrollment Help Desk told me that an LPEI could not be enrolled. LPEIs are independently licensed, and therefore you must complete the enrollment packet on them. There is currently not a specialty code for them.
So to enroll them, you'll use the specialty code 62, which says psychology, but that's the specialty code that you'll be using to enroll that particular provider.
And hopefully you heard Yvonne. She said, please use specialty code 62 to enroll your LPEI. I apologize that there was a misunderstanding on that RA, but that particular part of that RA did not apply to the RSPMI/OBH agencies. Just remember, you are not a group. You are an agency. If we do an intake after July 1st, and then they are determined to be a Tier 2 or Tier 3 by IA, then do we have to submit a master treatment plan for a confirmation number? No, you do not. You are automatically going to get that confirmation number once they receive a tier determination. Just to clarify further, child and youth support, is the parent required to be a part of this service every time? This service may be provided with the parent/guardian or the teacher or both. So the parent isn't required to be there when you're working with the teacher if you're working on behaviors, but that is not a child service. I don't know, I'm going to have to look at that. I don't know what the exclusions are. Go back up, there was one independent. So for independently licensed therapists completing the Medicaid provider application, can we submit the clinic W-9 form since we will be getting paid, or do the mental health professionals need to sign the W-9 form?
The W-9 form needs to be completed by the enrolling provider. So for the independently licensed therapist, the W-9 needs to be their information, their name, and their signature.
Did y'all hear that? For independently licensed clinicians, it has to be their name, their signature, their information on the W-9 form, not the agency information. So if you're not taking group affiliation forms, how are they going to make sure that they're guaranteed the payment goes to the correct organization? Yvonne, you want to take that one?
Because you will be billing with your agency number.
So just remember that when you're submitting those claims, the billing provider is your agency number, and the rendering provider is the person who is providing those services. Can we submit multiple service sites on one application? No, you have to submit those individually. Item 11 on the form, I'm assuming this is a question for you, Yvonne and Stacy, is for agencies only, or do we need to answer this for our individual clinicians only? If so, what certification number is it referencing?
The certification number is not required if you're doing it for independently licensed, because they don't have a certification, they have license. So therefore it's not needed.
So did y'all hear that? It's not required for individually licensed people. That is only if you are certified. If the facility is listed as a PCP with Medicaid on eligibility, is that the MPI we pull the claims for Tier 1 clients? So if the PCP, so like for the, is it the FP? The referring, yeah, the referring. That's what you put on there. Would the group affiliations suffice for the EFT information since the individual provider is not getting the payment into their account?
No. We need to have the EFT information for the enrolling provider.
Just want to make sure y'all heard, no, they have to have the EFT information for the enrolling provider. Do we need to leave the group affiliation form out of the Medicaid application for providers?
Yes, please leave it out.
Yes, please leave it out. Sherry, that's a dip squad question.
That's right, and it depends. I mean, I'm not going to answer
do I need to answer this question, or they just need to email you, Sherry?
They need to email us because I'm not quite sure about the telehealth and how you're going to monitor a QBHP. So I think maybe you need to be a little more specific on how you intend to be doing that in order for me to answer it. Or not me specifically, but DHS answer it.
So the question was for QBHP supervision, can it be done by telehealth by the MHP? So they need more information. You can reach out to Sherry Proffer for further assistance on that question.
When complete, and you also just please go out and look at your certification manual. I don't know if that I haven't looked at the certification manual, but make sure that you look at that manual and review it.
Yeah, there's a lot of information about BHP supervision in the certification manual for BHAs. I believe that's where it is. So yeah, there's a lot of detailed information in there about.
Yeah, and I also believe that it is face-to-face instead of telehealth.
Sherry, just email Sherry and look at the manual, and she's going to get back to you on that question as to the QBHP supervision. When completing the online enrollment application, can you enter more than one bill to address for a provider who works at multiple locations, or does the bill to address have to be the same as what is entered on the W-9?
The bill to address should be the same as what is entered on the W-9, and no, you can't enter more than one.
No, you can't enter more than one, and the bill to address has to match the W-9. I was told when I called Medicaid provider enrollment not to fill out the banking information because the company will be getting paid and not the provider. Is that correct?
The company will be getting paid. However, the banking information has to be completed for every provider that enrolls with Arkansas Medicaid.
So just to kind of, the provider will be getting paid, but the banking information must be included for every provider who is being enrolled. So please review the information given with regard to W-9 for those individuals who are working under the umbrella of an OBH agency. So I think, Yvonne, what you said is the W-9 must be completed for each individual. It is completed for the individually enrolling provider. Does provider enrollment need to be done on all clinicians?
So for your independently licensed providers, an application needs to be done for them. For your paraprofessionals, those that are not licensed, you'll do a PIN form, a practitioner's identification form for those providers.
And if they're non-independently licensed clinicians, they would still need a PIN, correct, Yvonne?
Correct.
Okay, so if you have LPCs, LCSWs, LPEIs, LMFTs, or psychologists who are working for you as a behavioral health agency, they must be enrolled. If you have LACs, LMSWs, LAMFTs, trying to get through this, or LPEs who do not have the I, they're not independently licensed, then they will need to get a PIN number. So will your QBHPs and all other staff that are working, providing billable services. How quickly will you notify the provider if there is an issue with his or her enrollment application?
As quickly as we can process.
Please provide Yvonne's contact information for provider enrollment. If you will email me, I will send you her email address. It's easier than her spelling it for you. Is this correct? 18, 19, and 20-year-olds can receive behavioral assistance, child and youth support services, peer support, and family support partners if appropriate. Yes, if appropriate. So what we're saying is we understand that there are some beneficiaries who are still in school at 18, 19, and possibly 20. So we don't want to keep them from getting those services which are really kind of youth services. However, we also understand that there are 18, 19, and 20-year-olds who possibly could need to go to a therapeutic community. And so for those beneficiaries, you could provide the adult services. What you cannot do is provide both. So you have to decide whether that beneficiary is going to be considered for the youth services, such as peer support, family support partners, behavioral assistance, or if you're going to move them over to therapeutic communities, they're going to get adult services. They can't be in both at the same time. So we've answered both of those questions. Yes, you can do adult services for 18, 19, and 20-year-olds as appropriate, or you can do the services, the child and youth services for 18, 19, and 20-year-olds as appropriate based on their school status. If the bill to address has to match the enrollee's personal address listed on the W-9, how is that not going to cause an issue with rendering providers receiving information that should go to the agencies they work for?
So I didn't say the bill to address has to match the W-9. The bill to address can be whatever address the provider wants it to be. Their mail to address needs to be an address that they're going to receive any information from Medicaid. So make sure that your mail to address is the address that you're wanting all of their information that Medicaid may have to send to the provider updated and correct.
But please remember that this is their Medicaid ID number. And so they're responsible for all of this information that is being mailed out. So I think your providers need to understand that this is their Medicaid ID number, it is their MPI number, and that they will be held accountable and responsible for all Medicaid regulations, all RAs, and all information that is being mailed out to them.
And if they're working for the agency, we're not mixing that with that provider. All the payment information should come to the agency because
Correct.
they're billing with that number. We're using their number as a rendering provider.
So please clarify if independently licensed providers of behavioral health agencies need to complete the provider enrollment form. Yes, if they are an independently licensed clinician, LCSW, LPC, LMST, psychologists, LBEIs, they must enroll and get their own Medicaid ID number. And that is then connected with their NPI number, correct? If our billing remit address is different than the provider practice address, what address goes on the W-9?
The W-9 is specifically for the individual that is enrolled. So it should be the individual enrollee information, not the agency's information. It is that individual's W-9. Their information needs to be placed in.
Oh, Sherry, another good question for you. For a certified agency, so this is a BHA, with more than one site location, and each location has its own MPI number, do we submit claims per location, or can we still submit them under our agency MPI number?
Each site has to bill under their own number. There is no group any longer, no group billing.
So just to kind of, in case you didn't hear Sherry, if you are a behavioral health agency with multiple sites, then you must submit claims utilizing each site's individual numbers. You cannot bill under a single Medicaid ID number for all sites.
And that is the reason why we have licensed each site separately.
If a BHA, behavioral health agency, has an LCSW with an MPI already, well, they still need to complete provider enrollment. So I'm going to tell y'all that we looked this up using my MPI number this week because I have been at multiple behavioral health agencies, so we wanted to look. So just because they have an MPI number does not mean that they have a Medicaid ID number ending in 19. If their Medicaid ID number, so my Medicaid ID number ends in 95, that is not okay. It has to end in 19. So just want to make sure you understand their Medicaid ID. If you have an independently licensed practitioner, even if they have an MPI number, because we all were supposed to have MPI numbers, they have an MPI number, it needs to be associated with a Medicaid ID number that ends in 19, not 95. Give, I don't know what. We have some confusion, so if we have an LPC or an LCSW who works only under our facility, and so first of all, am I assuming this is a behavioral health agency? We have done the enrollment process. Are we needing a W-9 for each of them individually? So I think part of the confusion has been, and we had this conversation in the office yesterday, so everyone was submitting an MPI enrollment form, correct, Yvonne? Previously, people were submitting those MPI, there was a form, a one-page form, an MPI reporting form. And so that was being submitted, and then what happened with that was that that provider then received a Medicaid ID number that ended in 95. If that's what you're talking about, then that is not sufficient. They have to enroll, they have to complete that enrollment application, and that includes the W-9. So if all they submitted was that MPI enrollment form, then that's not sufficient for independently licensed practitioners. They are going to have to go in and complete an enrollment, or you are going to have to go in and create an enrollment application, complete the W-9s and all the information. Please clarify the EFT information. You are stating that the information should be the individual provider's information and not that of the group.
Correct. The EFT information has to be that of the individual. If they are not willing to provide their banking information for the EFT, or if you choose to say that they're allowed to use your banking information, you'll have to give us a bank letter with that EFT information to process. But if we do not have the EFT information in the application will be denied.
So once the independent provider who works for a behavioral health agency is credentialed as a Medicaid provider, the BHA then still has to link their MPI and the Medicaid number with that form?
Once you do the application, you should have listed the MPI on the application for Arkansas Medicaid. If you have placed that MPI on the application, we will use the MPI that you put on that application. But if you did not put the MPI on the application, you need to include or send us an MPI reporting form so that we can add the MPI to the Arkansas Medicaid provider number.
We went through the enrollment process for all of our LCs and LPs yesterday online, and it didn't prompt us for a W-9.
Yes, it's on there. At the end of it, it asks for things to be attached, and one of those things was W-9. We are getting those W-9s with the application. If they are not in the application will be denied.
Is the 95 number sufficient for QBHPs and non-licensed clinicians?
Yes.
Yes. What specific forms need to be uploaded along with the individually licensed practitioner enrollment application?
The DMS 675, the DMS 689, the DMS 653, the W-9, the license, the EFT form, all those items need to be uploaded with the application.
Can you clarify what kind of letter must be completed if we include the agency's banking information?
Yes, you must include a letter from your bank on the bank's letterhead, signed by an official at the bank, stating that they authorize, or you authorize, the individual clinician to use that banking information to deposit monies from Arkansas Medicaid.
Yay, we're away from that. Will there be a place with Medicaid eligibility that indicates that what a person's tier is? Yes. So for Medicaid eligibility, so yes, starting in January, you will be able to not only see the beneficiary's tier result, you will also be able to see which task they've been attributed to. And this is a really great way for us to end this webinar today. So what we are asking providers, we understand that this has just really been a hardship for providers because we've sent over the blocks and some of those beneficiaries changed providers in the midst of that. And so we are working on a process whereby you can submit a list to us of beneficiaries, and then either we or Optum will match that list of beneficiaries and send you back all the tier results. So we are working on that process, and I will send out an email to your provider agencies to have them send that out to you, or we'll send it to Beacon and have them send out the process so that they can send it to all their contact people, because I understand some of you don't belong to a provider organization, but we'll be sending that out. So what we're going to ask you to do is submit a spreadsheet to us with the beneficiaries' names, their Medicaid ID numbers, their date of birth, and identifying information so that we can cross-reference those, and we will get Optum, or we personally will go through that list and send you the tier determination. So you have beneficiaries, so start thinking about how you're going to pull that information together, and I'll be sending something out. But we want to make sure you have those tier determinations because we know you need to get your treatment plans done, and we know that you need to know what services these beneficiaries are eligible for. So we are developing a process for that.
Okay, I'd like to thank DHS and Beacon for their presentations and everyone that joined us today. That concludes our presentation for today. I wish you all a great week.